A typical EMDR session ranges from 60 to 90 minutes. Before an individual starts EMDR reprocessing, which is mostly what people have heard of with the bilateral stimulation, which is a therapist is going to use their fingers to go across the client's range of view, I guess you could say. There's also things like tactile, you can hold buzzies or a light bar. But way before actual reprocessing happens, the therapist and client are going to work together in what we call a history taking and a preparation stage to identify what the client wants to work on. And so once there's a mutually agreed upon memory or target component, the therapist is going to ask the client a couple questions to activate that memory. And one of the beautiful things about EMDR that separates it from other treatments is you don't have to go into detail. Whereas in traditional talk therapy, you're sharing a lot of detail about that trauma or an adverse experience. With EMDR, you're just recalling a couple aspects of that memory. And so when those aspects are activated, as we call it, the therapist is going to use bilateral stimulation, once again using eye movement, either with the fingers or buzzies or a light bar. And that bilateral stimulation, we call it BLS, is used to activate both hemispheres of the brain. And through the activation of both of those hemispheres of the brain, it allows the memories that are stuck and unprocessed or raw to become processed. And as a result of that, those processed memories aren't going to be causing a disruption in that individual's daily life.